This study review looks at the efficacy of vitamin C supplementation during pregnancy to prevent preterm labor. The research problem is based off of the statistic that 10% of pregnancies are affected by preterm birth, which leads to increased rates of neonatal morbidity and mortality. 3% of pregnancies actually experience preterm pre-labor rupture of membranes, and overall that affects 1/3 of all preterm births. Women with a history of PPROM are shown to be deficient in vitamin C. This finding has led us to the presumption that vitamin C supplementation could prevent PPROM and preterm labor. Once rupture of membranes has occurred, there is no going back, and preterm birth is inevitable. Depending on the gestational age at the time of rupture of membranes, the woman could be close enough to her due window where the baby won't be born prematurely. Vitamin C supplementation could strengthen the amniotic sac by promoting collagen synthesis, but it can also fight against pathogens that could lead to preterm labor and prevent PPROM. The sampling method looks at 100 women in a maternity and children teaching hospital in Iraq with the history of pre-labor rupture of membranes. These 100 women were divided into two groups. The first group is the intervention group, which consists of 55 women who received 100 milligrams of vitamin C orally each day starting at 14 weeks pregnant. The other group is the control group of 45 women who were given a placebo pill. The study design is a randomized controlled clinical trial authorized by the College of Medicine at this college in Iraq, and the data collected is about age, previous pregnancies or abortion, BMI, gestational age at rupture of membranes, gestational age at birth, and birth weight. The study findings show that vitamin C intake during pregnancy increased the gestational age at the time of rupture of membranes from 29 plus or minus 2.29 weeks to 30.11 plus or minus 2.21 weeks. And the p-value of that finding is 0.033. Another finding is that vitamin C intake during pregnancy increased the gestational age at the time of delivery from 32.04 plus or minus 2.88 weeks to 33.31 plus or minus 2.43 weeks. The p-value of that finding was 0.019. One more finding is that vitamin C intake also increased the birth weight of babies from 1,951.1 grams plus or minus 869.72 to 2,409.1 grams plus or minus 613.44 grams. The p-value of that finding is also 0.019. A further question that I have is, if we know that vitamin C deficiency is found in women who suffer from PPROM or preterm labor, is there any way that we can predict that by looking at their vitamin C levels in their body during their first trimester and then comparing that with their third trimester to see if they are deficient and are at risk for either of those two conditions? Another question is are there effects of too much vitamin C during pregnancy? I don't think there are, because vitamin C is a water-soluble vitamin, so if you consume too much, you will just pee it out. But I would be curious to know. And then another question I have is there a difference in how somebody gets vitamin C, looking at supplemental vitamin C versus whole food vitamin C? And here is my reference page, and that completes my study review.